My name is Donna Christensen. I'm a clinical associate professor here in the School of Communicative Disorders, and I have been working here since 1987, which is 25 years, and the first year that I worked here was the year of the 25th anniversary of our department, and I still have the mug, which I found in my drawer and still use, so it's been a good 25 years here. As I've reflected on my time here, one of the strongest points in my memory is the connections that we have in the community and in the central Wisconsin area. And I think we've provided a wonderful service here for individuals in this area as well as training ground for our students. Back in 1987, we would go over there a few hours a week to see patients. And now there's a staff of 3 of us who are credentialed at the hospital who are over there full-time. So we're over there 5 days a week, 8 hours a day. So that volume has greatly increased, and I think that it's a wonderful opportunity for our students to get training in medical speech pathology. They really get some interesting experiences over there with very ill, acutely admitted patients, long-term rehab. We have opportunities to work in the radiology suites with the radiologist in performing swallowing studies. And probably one of the most recent expansions has been to work with the ear, nose, and throat physicians in ENT and working collaboratively to make some decisions about patients who are presenting with problems with their voice in terms of assessing them and what their treatment needs are. So that is the strongest connection that I have from my time here, and a relationship that has grown immensely over the years. It's not only been ministry healthcare, but we have had students placed at St. Joseph's in Marshfield, Aspirus in Wausau, Portage County Health Care Center, Stevens Point Care Center. We have seen hospice patients in their home who may need some help with the area of swallowing or augmentative communication when they have a life-threatening illness. And the other connection that we've had has been with a lot of the different support groups in the area. For many years we were involved with a laryngectomy support group for individuals that have laryngeal cancer, traumatic brain injury support group, Parkinson's support group. So I think the branches that we've had in the community have expanded a lot. One of the other big changes is that our program has grown in terms of the number of graduate students, and we now have 30 new speech-language pathology graduate students every fall. And the Doctorate of Audiology program has expanded our relationship with UW-Madison and that consortium. So I think both of our programs have blossomed and expanded in many wonderful ways. Well, one thing I'm particularly interested in is finding out what our students are doing, and especially some of those who were here when I first started in the late 80s and early 90s. I would love to know what kinds of careers that they've carved out.